Hey, this is Sarah with RegisteredNurseRN.com, and today I want to show you how to administer a soap Suds Enema. Many times in the hospital, your patient will be ordered some type of enema. There's different types. There's flea enemas, there's KX-lay enemas, or soap Suds enemas, just to name a few. Today I want to show you how to do the soap Suds enema. Here we have our bag. This is about a 1,000 milliliter bag. I filled it up to about the 500 milliliter part, and I have filled it with warm water. Whenever you're filling your bag, you'll want to check the temperature with your forearm just to make sure it's not too hot, not too cold. You want it warm, and you'll fill it up to the prescribed amount. The doctor usually writes how much to give, and you'll be putting inside of it. It comes with a packet of soap suds, and you'll mix it up. And what we'll do is we will insert this. This is the part of the enema bag that will go inside the rectum, and you'll slowly release this fluid into the rectum. Our goal is to cleanse the rectum from any hard stool that's built up, or just to get the bowels clean. A lot of patients are ordered this before surgery, but in most cases it's ordered for a patient who's experiencing constipation. So to do this, you'll get your supplies, you'll mix your soap Suds enema, and you'll get your patient. Always explain to your patient what you're doing with this procedure. And if you have someone who can help you, of course, get help with this as well. So get your patient. We have Miss Smith, our mannequin, who will be helping us with this procedure. We have her on her left side, and we have her right leg sort of bent. This just helps the fluid guide into the rectum. What you'll do is you'll take your cap off of your bag, and you'll lubricate this very well because it's a hard plastic piece, and you want this to be comfortable as it can be whenever it's inserted into the patient. You'll hang your bag on your IV pole, and get any towels, drapes, anything you need, because this procedure can get messy. You'll also might want to use a gown. The little blue isolation gowns we have stocked on the units, you'll probably want to wear one of those to help protect yourself. So what you'll do, check the area for any hemorrhoids, any bleeding, anything that you wouldn't want to insert something like this. So just look at the area, lubricate your tip. You have a clamp here. You'll want to make sure your clamp is away from the fluid. Okay. And watch out, it'll leak sometimes. And you have it lubricated, and you're going to insert into the rectum about 3 to 4 inches. Okay. Always, if the patient tells you that hurts or you meet resistance, stop, and you could try again. After you have inserted about 3 to 4 inches, you're going to hold your bag about 12 to 18 inches above the rectum, and slowly let your clamp release and let the fluid flow in. Warn your patient that they may feel some pressure, cramping, and if this is so, stop your bag for about 30 seconds and then start it again a little bit slower until all the fluid has infused into the rectum. It takes a couple minutes, but just take your time, and it'll be flowing in. And then whenever it's done, after all your fluid has flowed in, you'll take it out and clean the area. You may have a little bit of stool on your end of the cap. Just clean the area and throw away your bag. And tell the patient, cover up your patient, and tell your patient to hold the fluid in for about 5 to 10 minutes. And this just helps break up any hard stool and helps get the most effectiveness out of the enema. This is hard for a lot of patients because they describe feeling a lot of pressure in their bottom. And so if they can't hold it, just get them to the bathroom or get them on the bedpan. So after that, whenever your patient has the bowel movement, be sure to look at that, see how effective the enema was, and see if it has to be repeated. So that is exactly how you do a soap Suds enema. If you like this video or need any other nursing skill videos, please check out our website, RegisteredNurseRN.com, and thank you so much for watching.